You're 2 decades from taking out the trash in your brain. That's aging. Okay, let's just dive right into this, because that quote from Dr. Annette Bosworth, it completely reframes how we look at getting older. I mean, what if the cognitive decline, that awful brain fog, and the general sluggishness we all just accept as aging isn't just the passage of time? What if it's literally a buildup of uncollected biological garbage just sitting inside our heads?
It really begs this massive, absolutely provocative question. What if this decline just isn't inevitable? What if the lost focus, the aching joints, and the fatigue are simply a buildup of biological trash that your body literally forgot how to take out? And more importantly, is there a way we can flip a metabolic switch to clean it all up and actually reverse the clock?
Well, welcome to today's Explainer. I am so excited to guide you through this fascinating material. We are going to be exploring the clinical insights of internal medicine specialist Dr. Annette Bosworth, often known to her patients as Dr. Boz. Based on her decades of treating chronic disease, we're going to unpack her exact protocols for achieving metabolic flexibility and finally taking out that hidden cellular trash. All right, here is our quick roadmap for the Explainer today. Number 1. The hidden brain trash. 2. The trap of high insulin. 3. Ketones, a cleaner fuel. 4. Measuring your metabolism. And finally, 5. The keto continuum. Let's get to it. Section 1. The hidden brain trash. Symptoms of a clogged system. You know what's really wild here? It's how incredibly common these symptoms are. Dr. Bosworth notes that in her clinic, people just accept things like brain fog, a shrinking attention span, chronic joint pain, stubborn belly fat, and even a total lack of joy as just, normal aging. But structurally, these are glaring indicators of a clogged system. This is exactly what happens when your body generates way more cellular debris than it can sweep away at night. It literally packs this trash between the cells in your brain and your body, like stuffing garbage bags into the closets of your house. Moving on to Section 2. The trap of high insulin, the hidden epidemic. So we usually think of insulin simply as a blood sugar regulator, right? But Dr. Bose explains that insulin is actually an insulating hormone. Its whole job is to promote growth and store away energy for a famine that, well, in our modern world, never actually comes. When your insulin is chronically high, which is usually driven by highly processed carbs and all that frequent late-night snacking, it literally locks away your fat stores. And worse, it actively blocks your body from taking out that cellular trash. It's putting a padlock on the dumpster.
Now, the really crucial point is knowing how to spot this high insulin before a blood test even tells you. And these physical indicators derived directly from Dr. Boz's clinical observations are fascinating. Aside from the obvious expanding waistline, high insulin can cause skin tags in places like your armpits, which are literally tiny physical growths spurred by all that excess growth hormone. It can also cause dark, velvety patches on the back of the neck, known as acanthosis nigricans. And get this, it actually causes your body to restrict resources, which leads to disappearing hair on your toes and lower legs. Crazy, right?
Let's hit Section 3. Ketones, a cleaner fuel and bypassing the blockade. Think of it like this. You actually have 2 completely different metabolic engines inside of you. Glucose, which comes from carbohydrates, is your short-term energy. But it requires insulin to enter your cells, and it leaves behind a ton of that cellular debris we talked about. Ketones, on the exact other hand, are produced from burning fat. They are an incredibly clean burning fuel that actually acts as an antioxidant. Even better, they easily bypass the blood-brain barrier. That means they provide incredible, sustained focus for your brain entirely without needing insulin's permission.
So, how exactly do we flip this switch? Well, step 1 is lowering your insulin by cutting carbs and adjusting when you eat. Step 2, though, requires some serious patience. You have to empty your glycogen stores. Dr. Boz uses this brilliant metaphor. She compares it to crusty brown sugar shoved way in the back of your pantry drawer. It's stored, tightly packed sugar, and your body will stubbornly burn through absolutely all of it before it moves to step 3, which is finally burning your body fat to produce those beautifully clean ketones.
All right, Section 4. Measuring your metabolism, the data-driven approach. You know the old saying, you can't manage what you don't measure. You have to measure to actually know if you're taking out the trash. Enter the Dr. Boz ratio. It's super simple. You just take your blood glucose number and divide it by your blood ketone number. The lower the resulting number, the more efficiently you're burning fat. That means your insulin resistance is low and your body is in a prime, optimal state to clean out all that cellular garbage. Let's look at a real-world comparison straight from the source material to put this into perspective. The host had a glucose reading of 83 and ketones at 1.7. Doing the math, his ratio is around 48, so he is a highly healthy fat burner. But then look at Jack. His blood sugar looks totally normal at 88, but his ketones? Just 0.1, meaning his ratio is a massive 880. So despite a perfectly normal blood sugar reading, his incredibly high ratio reveals he is highly insulin resistant. He's generating tons of trash, but he is definitely not taking it out.
And that brings us to Section 5, the Keto Continuum, a step-by-step roadmap. Dr. Boz's Keto Continuum is very much a progression. You don't just jump in the deep end. It starts simply. For the first few days, just cut your total carbohydrates to a maximum of 20 grams a day. Only once your body adapts and you actually see ketones in your blood do you start pushing your eating window, moving to maybe 16 hours of fasting, then eventually sliding toward a 23-hour fast, basically one meal a day. For those with decades of really deep insulin resistance, she eventually utilizes advanced 36 to 72-hour fasts to completely hit the reset button on the pancreas.
But what if you get stuck? What if you've done the work, you cut the carbs, but your insulin is just so stubbornly high that your body absolutely refuses to produce a ketone? Well, Dr. Boz has a very specific, intense jumpstart protocol for this exact situation. It's called the Sardine Challenge.
100. That is an unbelievable number. That is the number of consecutive days a clinical patient named Jane ate absolutely nothing but sardines. Jane had severe insulin resistance and some really deep-rooted psychological battles with food. By committing to 100 days of literally just sardines, she not only shed massive amounts of weight and plummeted her insulin levels, but her previously deficient vitamin D levels absolutely skyrocketed, and she experienced this profound mental clarity and emotional freedom.
So, why on earth sardines? Well, when patients get distracted by all those complicated keto recipes and substitute desserts, Dr. Boz narrows their entire focus down to this one singular food. Sardines are practically the perfect keto hack. Think about it. They are packed with healthy fats and protein to keep you incredibly full. They have exactly 0 carbohydrates. They are super nutrient dense, supplying things like natural vitamin D, and they're a highly affordable whole food. It basically forces the body to drop insulin and start making ketones. No exceptions.
Now let's be real for a second. I want to manage expectations here with a brilliant quote straight from Dr. Boz herself. You'll love me in 18 months. Achieving true metabolic flexibility is absolutely not an overnight fix. If you've been running your body on dirty glucose and keeping your insulin sky high for decades, training your muscles and your mitochondria to actually prefer fat, that takes real, sustained time. It is a fundamental physiological transformation.
Which brings us to the big ultimate question to wrap up this explainer. If cognitive decline, brain fog, and physical sluggishness are really just the symptoms of uncollected biological garbage piling up inside of you, are you ready to lower your insulin, flip that metabolic switch, and empty the hidden trash in your brain? The tools to fix this are entirely in your hands right now. Thank you so much for joining me for this explainer. Keep learning, keep measuring, and I'll catch you on the next one.